on the other side, what are some of the major challenges in 2025? And so I'll start first with Dr. Trivedi, then Dr. Blumberg, and Dr. Chen.
Yeah, I think really in the world of certainly medical oncology, a major challenge that I often find in the clinic is patient selection for treatment. We still don't really have the best tools to determine who is going to benefit from different treatments. And I think that this still remains an issue, particularly with immune therapy. We have the best biomarker we have is PD-1 testing, and I think that we can all agree that that isn't optimal sometimes. And so I think patient selection for treatment still remains an issue.
Dr. Blumberg?
Yeah, thanks, Sid. Sort of is similar to that, and it sort of bounces back from the advances is that there are so many different variations or nuances to treatment that it's sometimes difficult to describe and discuss with a patient because it is so nuanced, and I think trying to come up with a collaborative decision with the patient can be difficult when you're trying to get into the weeds with all the different sort of techniques and possibilities. And so I think as the data comes out and we have some more sort of unity and how we're going to treat certain disease processes, will make that a bit easier. But I do think it's a bit challenging at this point to be able to have these discussions with patients, have them really understand at a high level. And then secondly, I think just patient selection is the toughest thing. And I think in the post-operative intermediate risk category that we alluded to before is really challenging because we know how bad this disease is. We also know how challenging side effects from treatment can be, and so it's difficult making those decisions without really sort of strong data directing us one way or another. And that's also true in the salvage setting in patients who have recurred, then have had surgery, and then there's not a lot of options left for them to treat them, even though we know they have high risk of recurrence. And so those are the things that sort of keep me up at night.